Starting April 1st, prescription birth control is going to be free in British Columbia. As a mom of 2 daughters and 5 granddaughters, I know the effect this is going to have on people's lives in our province. This is a win for health, and it's a win for gender equity in our province, and it's about time.
Big day in British Columbia. In 2 days from now, this Saturday, BC will become the first province in the country to make prescription contraception free to all residents.
I think it's great. I think it's really sending a great message and setting a good example for the rest of the provinces. It just seems like an important step in being in control of our own bodies.
So this means if you have a prescription from a family doctor or a pharmacist, and that's important, you still need a prescription. But if you have one, you just show up at a pharmacy, show your health card, get your birth control, and you don't pay anything out of pocket. So that applies to oral hormone pills, aka the pill, under the skin injections and implants, IUDs, and Plan B, or the morning after pill. And the cost of those contraceptives, they can really add up. I mean, you know, the pill costs about $25 a month. An IUD can cost upwards of $500, though that does last for a few years. And if you need Plan B, I mean, that's about $30, $40. So overall, the BC government figures that this plan could save a person up to 10 grand over their lifetime. And BC is spending $119 million over 3 years for this new program.
And the government is likely coming out ahead financially, too, saving tens of millions of dollars in costs associated with unintended pregnancy and abortion.
And that raises another interesting point here, that there is a broader goal here besides just saving people money. You know, consider, according to StatsCan, only about half of sexually active 15 to 24-year-olds reported that they or their partner were using the pill the last time they had sex. And about 10% of sexually active females between 15 and 24 reported having used emergency contraception, like the morning after pill, in the last year. And the Canadian Pediatric Society has, for years recognized unintended pregnancies as a problem worth solving. Since 2019, it's called for free contraception for anyone under 25. So with BC's new plan coming into effect April 1st, we wanted to know whether the rest of the country might soon get on board. Now, Ruth Habte is an OB-GYN resident in Vancouver who has been campaigning for this very thing, free prescription contraception, for a pretty long time, since 2019. Ruth, thanks for joining up with us.
Thank you for having me on.
So when folks ask you, why is something like this necessary, first of all, what would you typically tell them?
I would tell them it's for a myriad of reasons. First and foremost, it comes down to a personal level. Patients need contraception and they need these medications, and not being able to access them puts them at risk for unintended pregnancies, leaves their gynecologic conditions like pain and bleeding uncontrolled. And we know that it saves the government a lot of money as well.
When you say saves the government money, can you explain what you mean by that?
For sure. So the provincial governments pay for the downstream effects of not having access to contraception.
Now, birth control is already subsidized for Yukoners on social assistance, but the Yukon NDP says that's not enough.
But these subsidies only cover contraceptives for a small fraction of people. It's 2023. The bare minimum is not good enough anymore.
So they pay for the management of unintended pregnancies, which could be abortion care, which could be labor and delivery costs. They also pay for emergency room visits if this person happens to have a miscarriage and presents to the emergency room. So all of those things are covered by provincial health insurance. But the upstream preventative effect of contraception currently across the country were not. So the government can save money by spending less money on contraception than it would on the downstream effects.
And a moment ago, you were talking about the sort of the personal and the social cost of unintended pregnancies. I mean, you must see that sort of thing firsthand all the time in the patients and people that you see.
For sure. So I was a pharmacist before. I'm an OB-GYN resident now. I see the cost of unintended pregnancy on the personal level all the time. Unintended pregnancies derail life plans. They put people in awkward scenarios. For example, if they happen to become pregnant with an abusive partner, now they're kind of stuck in this not great situation for themselves. We know that unintended pregnancies make it less likely for a person to finish high school and then have less income moving forward in their life. So certainly planned pregnancies and pregnancies that people are looking forward to are ones that are best for folks. So we really just want to make sure that people have access to the choice of their contraceptive.
Everything that you just said, I mean, was that a difficult argument to make to the province? Because I'm sort of wondering why it took as long as it did to have this actually go into effect.
Yeah, I mean, that's a great question. It's a policy that is in place in a number of different areas in Europe. We know that there's been studies done as well in the United States in limited areas that have again and again and again shown the social benefits as well as the individual monetary benefits and the governmental monetary benefits. I think part of putting in a policy like this is public education and ensuring that the population understands that there is robust research around a policy of free contraception. And once we have that public favor in place, then it is much more likely to have a government adopt that policy in a platform, for example, which is what happened in BC.
Right. So bring me a little bit behind the curtain into what that effort was like, because ultimately what I'm trying to figure out is how you replicate the success that you've had in BC in other provinces.
Yeah, so Access BC is a reproductive justice campaign that was started in 2017 by Dr. Teal Phelps-Bondaroff and Devin Black in Victoria. And essentially, it was a letter writing campaign, a tabling campaign at various universities, and then as well a campaign that went to budgetary consultations. And then, of course, by 2020, when the election happened, the NDP party endorsed that as part of their platform, and very quickly the Green Party and the Liberal Party endorsed it as part of their platform as well, secondary to public outcry, essentially. And so I do think that it's something that's possible in other jurisdictions.
Should the NDP form government, we commit to universal coverage of birth control.
It is time that Ontario takes an important step towards gender and reproductive equality and commits to covering prescription contraceptive care under the Ontario Health Insurance Plan.
We obviously are looking very closely at what British Columbia has proposed.
The opposition NDP says it would support paying for birth control if it was in power, but the Ministry of Health says right now it has no plans to change contraceptive coverage in Saskatchewan.
Again, when there is such public favor for a policy like this, it makes it very easier, for a government to want to adopt it.
So I guess the question then is, why isn't there that sort of similar public enthusiasm in the other provinces in this country?
You know, I think a lot of it has to do with education. People hear a policy where things are being given to folks for free, and they think of the bottom line and think that it would cost the government more money, which is not the case for a policy like this. I think part of it has to do as well with the taboo around sex education and contraception, and that can be an uncomfortable topic for a lot of people. Certainly, I've seen that myself as an OB-GYN resident doctor. And I think by combating these two things and ensuring that the public understands the benefits of a policy like this makes it a lot more likely for the government to be able to adopt a policy in this nature.
Sophie, you've been campaigning for this to happen for some time with Access BC. How does it feel to see the change?
Yeah, it's incredibly exciting. We're so happy to see BC become a beacon of hope, really, for reproductive justice across Canada, and we hope to see that momentum continue in other provinces.
It might seem like a small step, but once again, that just adds up quite a lot, and it will make a big difference for women not to have to shoulder another burden.
Ruth, what would the broader impact be if every province adopted what British Columbia is adopting?
So the broader implication would be the cost savings, of course, being one of them on a personal level and on a population level. I think I would hope that a policy like this would also go hand in hand with increasing accessibility for folks that live in northern or more remote regions. I think it would look like achieving health equity for reproductive health care across the country, and that would be very welcomed in my point of view.
Hey, Ruth Habte, it's been really good to talk to you. Thank you so much.
It's been great talking to you too. Thank you.